Welcome to the Vatech Video Education Center. In our session today, we're going to review the capture software for the PaX-i 3D Panorama specific, with the objective to review and verify mode, patient name, exposure, identifying patient type and density, image quality, arch selection, pano examination modes, orthogonal modes, special examination modes, selecting the confirm button, and selecting ready. We'll begin our process by searching for our patient within the EasyDent4 viewer, either by chart number, first name, or last name. In this case, we'll do a search by chart number, enter our number, select enter on the keyboard, verify this is the correct patient, left click on the patient under the patient list, and then left click on the icon that states Dental CT. Selecting the Dental CT icon will then launch our capture software. It is this capture software which is now communicating with your device to determine what type of image to acquire as well as its exposure setting. In this window, we can verify what mode that we're in, the patient that's going to be scanned, the exposure for that particular scan, as well as our image options along the right-hand side. In this case here, we're going to verify that we are in the pano mode for doing our 2D panorama image. We can then also verify that we are in the correct patient chart by identifying our chart number, name, gender, as well as her age. It's this demographic information that will automatically set the KVP and MAs for our particular exposure. We have the option of male, female, as well as child. Any patient who is 13 years or under will automatically default to child. However, it is encouraged to look at each patient on a patient-by-patient basis to determine whether the growth meets the age of that particular patient, or if they excel and have a much later growth development, such as a late teen, then they should be moved to an adult category based on gender of either female or male. Once we set our exposure based on gender or age, we also have the ability to adjust our exposure based on density, such as hard, normal, and soft. Classifications for these would be such as age, where an 18-year-old patient potentially has a harder bone density than someone who is elderly and may be under a softer category. Facial features, someone as a patient having excess fat content may require more radiation to get proper exposure, as well as ethnic differences, such as African Americans and Asians having a harder bone density than Caucasians. A vast majority of your patients will probably fall under the normal category, so it's encouraged to look at each patient on a case-by-case basis to see which end of the spectrum they fall under. Once we've chosen the exposure for our image, we can then navigate to the upper right-hand corner and determine our image quality. And there are three image quality options to choose from: normal, high definition or HD, ultra high definition or UHD. Depending on which option you select will then make changes as far as the device as well as image quality. For instance, under normal, the exposure time is roughly 10 seconds. HD is roughly 13 seconds. UHD is a 20-second scan. The detail that you'll render within the image is also directly proportionate to the size of the image. For instance, normal will generate an image size roughly 1 megabyte, HD between 3 and 4 megabytes, and UHD roughly 30 to 40 megabytes in size. Due to the size of the file, this will also affect the amount of time needed to recreate these images. For instance, normal is between 3 and 5 seconds of processing time, HD between 5 and 10 seconds of processing time, and UHD between 15 and 20 seconds of processing time. The most common option is HD, or high definition, which is a 13-second scan and roughly 3 megabyte image size. Once we've chosen our image quality, we can then determine our arch selection. The first three options here pertain to an adult: narrow, normal, and wide. Depending on the actual morphology of the patient will then determine what category they will be applied to. For instance, someone who has a very narrow, slender, or V-shaped arch would be applied to narrow. Someone who has a very broad, wide, or U-shaped arch will be applied to wide. This will then change the angle of the propagation of the X-ray tube to avoid overlapping of the teeth between the anterior and premolar region. A vast majority of your patients, however, will be applied to normal. So it's recommended to look at each patient on a patient-by-patient basis to determine whether they may fall under narrow, or wide, or normal. Another automatic configuration of the Capture software is the child arch selection. In the Capture software, if the age of the patient is 13 years or under, not only will the exposure be set to child, but the arch will then automatically set to child as well. Two things are happening when the arch option is selected for a child. Number one, the rotation time is 2 seconds less to accommodate for the fact that a child's arch is not as deep as an adult, so the rotation time is less. The top of the image is also collimated to avoid radiation penetrating the patient's eyes. But just like the child option for exposure needs to be done on a case-by-case basis, so does the child option for the arch selection. As an example, if a 13-year-old patient is placed in the device but has the growth development of a late teen where it should be an adult category, the device is not going to rotate far enough and the condyles could potentially be cropped off. Conversely, if a young patient, let's say 8 or 10 years old, is placed in the device and is set to one of these adult options, chances are the device is going to over-rotate and capture beyond the condyles to also include the spine. So for these reasons, it's important to make sure to select one of these three options for an adult, this option here for a child on a case-by-case basis. In my discussion talking about arch selection between adult and child, I'm going to bypass the orthogonal mode for a moment to identify the 4 pano examination modes available. Standard, which is a full panorama image going from condyle to condyle for a child as well as for an adult, also allows you the ability to do a scan of just the right-hand side of the arch, left-hand side of the arch, as well as the central dentition without the condyles. For offices that want to acquire bite wing images, but due to the morphology of the patient either having a shallow arch, tori, or perhaps a gag reflex, there is also the orthogonal mode. By selecting it, not only do you have the ability to still acquire a standard, right, left, as well as front, you also have the ability to capture a bite wing which will capture right and left, bite wing right, bite wing left, and bite wing central incisor. In addition to the pano examination modes, there are also the ability to acquire special examination images such as TMJ lateral open, TMJ lateral closed, TMJ PA open and closed, as well as sinus lateral and sinus PA. Discussion as far as using these options here will be discussed in separate learning videos. So with that being said, let's proceed with our plan to capture a full panorama image on Jane Doe. We'll start again on the left-hand side to verify that we are in the correct patient chart, identify that she's a female, and then 23 years old. I'll left-click on Woman, left-click on Normal as far as body type, left-click again up here on HD for high definition, left-click on Normal as far as arch type, left-click on Standard to do a full panorama image from condyle to condyle. From here, verify that all of your options are correct, and then left-click on Confirm. This will then send the commands to your device for the image type and exposure for your patient. Once the device is ready, you'll be prompted to position your patient. In summary, we want to make sure to select and verify the following: our capture mode between Panorama or Panorama related image, our patient demographics including name, birth date, and gender, select and verify our patient type and density for our exposure between male, female, or child, as well as density of hard, normal, or soft. Select our image quality between normal, HD, or UHD. Select our arch between narrow, normal, or wide, making our panorama examination option between standard, right, left, or center, as well as orthogonal modes including bite wings such as right, center, or left, and lastly our special examination modes including TMJ open and closed and sinus lateral and PA, which will be discussed in later training videos. Selecting confirm, which will then set the image type and exposure. Lastly, selecting ready to set the device and capture position. This concludes our training tutorial on the PaX-i 3D capture software. Thank you for being a valued member of our Vatech America family.